Hello, I'm Dr. E. Barry Gordon, and this is the 15th video in my series on testosterone deficiency. Today's subject is a condition that is probably the primary reason the disease of testosterone deficiency is so tragically ignored and neglected: prostate cancer. It is the most common cancer to affect men. Statistics show that 1 out of every 6 men will get prostate cancer during their lifetimes. I believe that number could be drastically reduced, but that's a subject for the next video. As was the case with osteoporosis, I'm first going to show you the fiction of prostate cancer and then the reality. There's also a lot to absorb and think about in this video, and again, you might benefit by watching it more than once. One side issue before we begin. The word androgen is going to be used frequently today, and you need to know that testosterone is the primary androgen. It's been an axiom in medicine for well over a half-century that giving men testosterone will cause prostate cancer. Almost all doctors still believe that. Everyone I know does. That was a medical truth I had always wondered about. It never really made sense to me that a basic hormone necessary for growth, maturation, and reproduction, the hormone that provides men and women with strength and energy, would suddenly one day turn into a cause of cancer. Nor did that truth fit in with the obvious facts that the risk of getting prostate cancer steadily increases as men grow older and their testosterone levels decrease, while young men with the highest testosterone levels virtually never get prostate cancer. I had no reason to be very concerned about that supposed relationship for the first 30 years of my professional life. A little over a decade ago, however, that abruptly changed when I began to suspect the existence of a whole host of diseases and conditions related to testosterone deficiency. It started to look like I was going to be treating a lot of people with testosterone, and I was wary and hesitant at first. My decision to proceed with diagnosing and caring for the disease was based on several factors. Firstly, 30 years had passed, and I still had never found an explanation as to how testosterone could cause prostate cancer when only men with the very lowest testosterone levels ever got prostate cancer. And secondly, every clinical study on testosterone that I had ever seen had always included the finding that no increase in prostate cancer had been found. And finally, there is an official Federal Drug Administration warning about the possible association of testosterone with prostate cancer, but closer consideration revealed it to lack any credibility. If, after being available by prescription for over a half-century, the Federal Drug Administration could state that the warning applied only to men who were very old, and that there was really no conclusive evidence, and the strongest word they could use to connect testosterone and prostate cancer was to call it a concept, then the connection obviously wasn't there. With detailed lectures to prospective patients as to general medical opinion versus the facts and my beliefs, I began to treat increasing numbers of deficient, symptomatic men with testosterone. You can imagine how pleased and reassured I was when Harvard Medical School came out with a study on that subject in November 2006. Incidentally, all the studies I mentioned, plus many dozens more, along with all previously released videos, can be found on my website, www.thehiddendisease.com. This was Harvard's conclusion. Quote, "This historical perspective reveals that there is not now, nor has there ever been, a scientific basis for the belief that testosterone causes prostate cancer to grow. Discarding this modern myth will allow exploration of alternative hypotheses regarding the relationship of testosterone and prostate cancer that may be clinically and scientifically rewarding." Close quote. Wow. Harvard study was only the beginning. Just 1 month later, Curie University in Paris published their own study. Quote, "Data from all published prospective studies on circulating level of total and free testosterone do not support the hypothesis that high levels of circulating androgens are associated with an increased risk of prostate cancer. Also in 2006, Dr. Leonard Marks of UCLA published a study in the Journal of the American Medical Association. He had performed prostate biopsies on men, treated them with testosterone for 6 months, and then biopsied them again. He wanted to see if the testosterone had had any effect on the prostate tissue. His conclusion, quote, 6 months of testosterone replacement therapy normalizes serum androgen levels, but appears to have little effect on prostate tissue androgen levels and cellular functions, close quote. In 2007, a Turkish study on this question was published. Their conclusion, quote, our data suggests that patients diagnosed with prostate cancer have low levels of serum testosterone and high levels of serum FSH compared with the patients with benign prostatic hypertrophy. No support was found for the theory that high levels of testosterone increased prostate cancer risk. As a side issue, note the finding of elevated FSH. I discussed that matter in some detail in my 5th video. FSH is a pituitary hormone that stimulates the ovaries and testes to produce the reproductive hormones. The secretion of FSH is controlled by the brain, and it becomes elevated in both sexes when ovaries or testes begin to fail. Our brains know how important the sex hormones are to our health and our survival, and are trying desperately to get our ovaries or testes to function adequately again. Studies on the testosterone-prostate cancer relationship are still coming out. In February of this year, 2008, no less an institution than the National Cancer Institute published a study. Their conclusion, quote, no associations were found between the risk of prostate cancer and serum concentrations of testosterone, close quote. Many of you might be wondering how it was that the myth of testosterone causing prostate cancer got started in the first place. Harvard addressed that issue in their 2006 study. Quote, in 1941, Huggins and Hodges reported that marked reductions in testosterone by castration or estrogen treatment caused metastatic prostate cancer to regress, and administration of exogenous testosterone caused prostate cancer to grow. Remarkably, this latter conclusion was based on results from only one patient. Multiple subsequent reports revealed no prostate cancer progression with testosterone administration, and some men even experienced subjective improvement, such as resolution of bone pain. More recent data have shown no apparent increase in prostate cancer rates in clinical trials of testosterone supplementation. Now, it is well known that the almost complete depletion of testosterone will stop most prostate cancers from growing. That's what drugs like Lupron, for example, accomplish. It's called a chemical castration. So the logical question is, if the absence of testosterone stops prostate cancer from growing, shouldn't the presence of testosterone promote tumor growth? The answer to that question is yes, but a very highly qualified yes. Here's Harvard's explanation. Quote, the apparent paradox in which castration causes prostate cancer to regress, yet higher testosterone fails to cause prostate cancer to grow, is resolved by a saturation model in which maximal stimulation of prostate cancer is reached at relatively low levels of testosterone. What they are saying is that the amount of testosterone that will stimulate prostate cancer to grow as much as possible is very, very small. It's so small that even severely deficient men coming to my office have at least 3 to 4 times as much before they receive any replacement. The entire issue of prostate cancer and testosterone replacement boils down to this. If men with severe symptomatic testosterone deficiency still have much more than enough testosterone to stimulate prostate cancer as much as it can possibly be stimulated. Where is the possible harm in them having more testosterone? Enough testosterone to be healthy. If we step back and look at the big picture, we see that one study done on one patient 57 years ago has caused almost the entire medical community to ignore a hormone deficiency that plays a significant contributing role in aging, in most diseases, and in most causes of death. It's one more unbelievable chapter in the testosterone story. Now, after going through all this to show that testosterone has no connection with prostate cancer, I'm going to reverse myself. Because while testosterone certainly does not cause prostate cancer, I believe that the lack of testosterone is one of the major causes of prostate cancer, probably even the primary cause. This will be the subject of my next video. Please help me make everyone aware of the existence of this disease. Alert your friends and relatives. Email these video links to everyone you know. You'll be doing them all a great favor. I'm Dr. E. Barry Gordon. Thank you for watching.